You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, welcoming you to the September 2025 edition of Editor's Summary. This month's interview is by an Associate Editor, Dr. Christine Peshkin, who will be interviewing Drs. Karen Cohen-Haga, Shay Kavidi, and Oshrat Tyre-Schiffman regarding their paper, Prevalence, Risk Factors, and Outcomes of Chronic Kidney Disease in Patients with Systemic Lupus Erythematosus with and without lupus nephritis.
Did the high prevalence of CKD in the non-nephritis patients surprise you?
I think it surprised us. We were expecting a high prevalence of CKD actually, but we found that almost half of patients with CKD never had lupus nephritis before. So who are those patients? And probably there are interplay, like Professor Cohen said, between other mechanisms of lupus, inflammation, accelerated atherosclerosis, hypertension, diabetes, side effects from steroid treatment that probably add to this development of CKD. So it really did surprise us. And we think that now that we see that half of the patients with CKD are not with lupus nephritis, I think that the striking thing is that we are used to follow patients with protein, all lupus patients, and especially patients with lupus nephritis. And now, after we saw those patients and we saw the numbers of patients with CKD, we feel that we need to follow these patients with albuminuria also. Like Professor Cohen said, it's an early sign of CKD. It's the time frame that we can intervene and treat with our kidney protective agents. And we know from our cohort that most of the patients that we defined with CKD, they had albuminuria and not EGFR decline. And we know that albuminuria from other studies, not in lupus, but in patients with CKD, that albuminuria itself without the EGFR decline is also associated with severe outcomes like cardiovascular morbidity and mortality and other severe outcomes. So that, I think, is one of the most important things about this study.
I hope you enjoyed listening to a part of Dr. Peshkin's interview with the authors of their paper titled Prevalence, Risk Factors, and Outcomes of Chronic Kidney Disease in Patients with Systemic Lupus Erythematosus with and without lupus nephritis, and that you will listen to the full interview, which is available at our website at www.jrheum.org and on our YouTube channel. Now moving to the other articles of the September edition of the Journal of Rheumatology. The interaction of lifestyle and genetic susceptibility is an important interaction regarding the risk of developing ankylosing spondylitis. In their paper titled Modified Lifestyle Factors, Genetic Susceptibility, and Incidence of Radiographic Axial Spondyloarthritis, Liu and co-authors used data from the UK Biobank to examine over 380,000 individuals who did not have ankylosing spondylitis at baseline and used a combination of a lifestyle score, which consists of 6 factors, and a polygenic risk score, which analyzed the AS-associated genetic loci. During a median follow-up time of 13.6 years, 694 patients were newly diagnosed with radiographic axial SPA. The authors found that an unfavorable lifestyle was associated with an increase of developing radiographic axial SPA, and that patients with an unfavorable lifestyle and a high genetic risk score had the highest risk of developing radiographic axial spondyloarthritis. Systemic sclerosis associated interstitial lung disease is an important cause of morbidity and mortality. In their paper, Outcomes in Systemic Sclerosis Associated Interstitial Lung Disease, based on serologic profiles with a focus on anticentromere and anti-RNA polymerase 3 antibodies, Volkmann and co-authors performed a post-hoc analysis of the census trial, which tested nintedanib versus placebo in patients with scleroderma interstitial lung disease, and found that patients with scleroderma interstitial lung disease who were negative for anticentromere antibody, anti-polymerase 3 antibody, and Tofacitinib 1 antibody had the highest risk of progression of their interstitial lung disease, although progression was seen in some patients who were anticentromere or anti-RNase polymerase 3 antibody positive. In an accompanying editorial, Doctors Brunei, Elhai, and Dissler from the Department of Rheumatology, University Hospital Zurich, Switzerland, suggest that with the advent of medications that can slow progression of interstitial lung disease in patients with systemic sclerosis, risk stratification is becoming increasingly important, and they review the importance of autoantibody profiling in patients with systemic sclerosis. The next paper is by Harama and co-authors and is titled Efficacy of Tumor Necrosis Factor Inhibitors for Refractory Leg Ulcers in Cutaneous Polyarteritis Nodosa, a case series. The authors reported that 10 patients with recurrent leg ulcers secondary to cutaneous polyarteritis nodosa had complete re-epithelialization of the leg ulcer, which was accompanied by significant reduction of glucocorticoid dose following treatment with a TNF inhibitor. Clinically inactive disease and clinical remission are important indicators of the therapeutic effect of medications in patients with JIA. In their paper titled Clinically Inactive Disease and Remission in Patients with Juvenile Idiopathic Arthritis Receiving Tofacitinib, post-hoc analysis of a phase 3 trial, Consolero and co-authors showed that tofacitinib rapidly decreased the mean JDAS-10 score. At week 44, 25% of the patients who remained on treatment achieved an ACR clinical remission. However, it should be noted that at week 24, only 88 of the initial 225 patients who entered the trial remained on tofacitinib. A small proportion of patients achieved JDAS-10 remission at week 44. It has been demonstrated that Denosumab, an anti-RNA ligand monoclonal antibody, increase the bone density and reduce the fracture rate in postmenopausal women with osteoporosis. In their paper entitled Long-Term Effectiveness and Safety of Denosumab for Osteoporosis in Patients with Rheumatic Disease, it has been demonstrated that Denosumab, an anti-RNA ligand monoclonal antibody, can increase bone density and reduce the fracture risk in postmenopausal women with osteoporosis. In their paper titled Long-Term Effectiveness and Safety of Denosumab for Osteoporosis in Patients with Rheumatic Diseases, Furukawa and co-authors demonstrated that lumbar spine BMD significantly increased over 7 years, while femoral neck, trochanter, and total hip BMD significantly increased for up to 3 years in the 165 patients with rheumatic diseases and either primary or secondary steroid-induced osteoporosis. The retention rate of denosumab at 7 years was 68%. The most common adverse event was infection. There were 2 cases of osteonecrosis of the jaw, and there were 10 new fractures during the treatment with denosumab. In an accompanying editorial, Drs. Cohen and Saag from the University of Texas Southwestern Medical School, Dallas, USA, and the University of Alabama at Birmingham, USA, respectively, summarize the current state of knowledge regarding denosumab for the treatment of osteoporosis in general, and more specifically and importantly, in patients with rheumatic diseases. Baden and co-authors performed a systematic review of the clinical trial designs and outcome measures in patients with Sjogren's disease in randomized clinical trials. They found that there was significant heterogeneity in the designs and the outcomes of the 60 randomized clinical trials. And over time, there was an increased use of composite outcomes that included patient-centered outcome and a concomitant shift away from objective dry eye measurements. As in most rheumatic diseases, adherence to medication remains suboptimal in people with gout. In their paper titled Patient Perspectives and Experiences with Medication for Gout, a thematic synthesis of qualitative studies, Twefton and co-authors performed a systematic review to identify themes that were present from 45 studies of over 1,200 patients in order to provide a better integration of patient perspectives into decision-making. The important patient issues identified were avoidance of pain and suffering, restriction of lifestyle, stigmatization from their disease, an uncertainty of why medications were used, and a lack of comprehensive information of their disease with a desire for increased empowerment. I will now highlight 2 papers we published this month regarding guidelines and/or standards of care. The first is by Sukar and co-authors titled Development of the Australian Rheumatology Association Clinical Care Standard for the Diagnosis and Management of Rheumatoid Arthritis in Adults. They formulated 13 quality statements and established 7 guiding principles for RA care, which they felt should be used by health professionals and services, consumer organizations, and policymakers in order to improve the quality of care for adults with RA, not only in Australia, but worldwide. The second is by Guthumbi and co-authors titled Canadian Rheumatology Association Guidance for Developing and Endorsing Quality Measures to Support Learning Health Systems, where they outlined an extension and relevant framework for the development and or endorsement of quality measures for rheumatology care in Canada. This framework was established in order to permit the streamlining of future quality improvement efforts, national and international levels. The article this month, featured in Panorama, 360 Degrees of Rheumatology, is titled East Meets West, a Canadian Rheumatology Resident's Experience in Hong Kong, in which a Canadian rheumatology resident describes their experience in Hong Kong medical system during an elective and compares it to their experience in Canada. With two images in rheumatology this month. The first is titled Not Everything is Osteoporosis, Multiple Low Impact Fractures in an Adult Female Patient, in which the authors describe a woman who was diagnosed at age 47 with pycnodysostosис, despite the fact she had had multiple low-impact fractures. They also sequenced the gene and found a known homozygous mutation. The second image is titled Zebra Bodies in Kidney Biopsy, Drug-Induced Phospholipidosis in a Patient with Systemic Lupus Erythematosus. The image is of a biopsy of a transplanted kidney in this patient, which showed zebra bodies, or what's called myeloid bodies, which are made up of concentric laminated lipid-containing deposits within lysosomes. Although these structures are most commonly associated with Fabry disease, in this patient, her renal disease improved and resolved following discontinuation of hydroxychloroquine and azithromycin. Both of these medications are known to be able to accumulate in lysosomes, causing lysosome dysfunction and possible phospholipid accumulation. We have two research papers this month. One is titled Varicella Virus Vaccination in Patients with Immune-Mediated Inflammatory Diseases, Drivers and Barriers. And the second is titled Advancing Knowledge and Care for Axial Spondyloarthritis in Latin America through a Unified Database, the ESPLADA Registry. We also published a report of the development of acute calcium pyrophosphate crystal arthritis in two patients following treatment with immunotherapy. One was following treatment with acalabrutinib, a Bruton kinase inhibitor. The second was following treatment with niraparib, a poly-ADP ribose polymerase, or PARP. I want to thank you for listening to this podcast and encourage you to read all the articles in the September 2025 edition of the Journal of Rheumatology, which are available either in print or online at our website at www.jrheum.org. And I please invite you to watch the interview of the highlighted article of this month, and if you missed any from the past months also. They are available for viewing at our website and our YouTube channel. If you have any comments or questions of any of the articles in the Journal of Rheumatology, please send them to manuscripts@jrheum.com. And please join me for the October 2025 edition of Editor's Summary. And as always, thank you for listening.